You know, our country's opioid addiction crisis has been declared a national public health emergency. But could legalizing a different drug be the solution? Take a look at this.
Treatment centers, tighter pharmacy regulations, stricter laws. These are just some of the tools to put a dent in the opioid drug epidemic that is killing thousands every year. But could the answer actually be another drug? A recent study published in the Journal of the American Medical Association looked at the rates of prescription opioid use in states with greater access to medical marijuana and found that people with easier access to legal marijuana to treat chronic and acute pain were less likely to get prescription opioids. In fact, states with medical marijuana laws saw a 14% reduction in opioid prescriptions. That's 3.7 million fewer doses every day. But critics worry marijuana to curb opiate abuse is just a quick fix for a growing addiction problem. So is this a potential solution or just another slippery slope?
Joining us is Dr. Adie Wilson-Poe. She's a neuroscientist and medical cannabis expert who agrees with these findings, i.e. that the use of marijuana may curb the use of opiates. And on the other side is our friend and colleague, Ken Seeley, drug and alcohol addiction expert and interventionist. So let's start off with you, Dr. Adie. Is this just putting a Band-Aid on what's really a bigger problem?
Well, I mean, there's no doubt that this is one of the biggest healthcare crises that we have seen in all of the history of planet Earth. But what we're really excited about is all of the evidence that has finally been pouring in over the last few years, most recently demonstrating that opioids prescription and opioid use is decreased in states with medical and recreational cannabis laws. When people have access to cannabis, they automatically cease their opioid use by half. There are 100 million people living in this country with chronic pain, and they need something to improve their lives. There's evidence that shows that over the course of a year, people who take opioids are not as well off as people who do not take opioids. They are not effective for chronic pain, and cannabis is. It is effective, and it is sustainable.
All right, Ken, tell us what you think.
Yeah, I totally disagree because, you know, there's so many people out there dying, and it's not an opiate crisis, it's an addiction crisis. Yes. People are numbing an issue that's internal, that they're having a problem like dealing with a trauma, and they're not dealing with that. So giving them marijuana to deal with that is just feeding in another addiction. Why would you legalize it? Why would you allow it? It's just like alcohol.
Marijuana has different components. So you have the THC, which can cause you to be high, but you also have the CBD, which can give you medicinal benefits without getting high. So are you okay with the CBD, or are you just saying no to all of it?
No, I'm totally okay with that. As long as the FDA gets involved and they approve it, absolutely. If they're going to use it as medication, let's use it as medication. But that gets approved by the FDA. That's not my decision to say, oh, this reduces my pain. That's not a decision that we could make. That's a decision the FDA makes and turns it into medication.
So, Dr. Adie, are you okay with eliminating the THC component and then keeping the rest of it?
Yeah, I'm in favor of both because we also know that THC has incredibly powerful pain-relieving properties, and we know that the vast majority of people who have chronic pain also suffer from mood disorders. This is two birds with one stone. Opioids anesthetize those emotions, whereas cannabis actually enhances positive emotion.
All right, well, we've had a very interesting discussion here. Dr. Adie, thank you very much. And as always, Ken, a pleasure having you.